Did you get your breath?
I did. I'm good.
Okay. Were you in
tested
the
it a bunch.
accident? No.
No, somebody needed
Okay.
some
All
medicine
right.
from the
Okay.
office. I had to stop by.
All right. Okay. So this is Dr. Rangi. Um, I've been calling her Dr. J, and that's what I put. I don't know how she feels about that.
It's perfect. It's perfectly easy.
Okay.
Whatever you can say.
Yeah. Okay. All right. And we had two questions. One is, what is your? Now you can save it for later if you want. But anyway, what is your question? What is your opinion on metformin for diabetes?
Mm-hmm.
And the second question was, okay. All right. With
Well, yeah.
what, you may save them or you may.
I think
Okay.
I would like to save that because you'll hear quite a bit. Okay, thank you.
Okay, thank
Thank
you.
you so much.
Mhm.
I do want to answer metformin really quick because that's not going to take that long. Metformin has been recently in a lot of studies even to look at anti-aging. So a lot of people are taking, not recommended, I'm not telling you all to, but there are people who are taking metformin nowadays for anti-aging too. So in other words, there's research going on, there's new findings that we're learning, and metformin has been out there in the use for thousands of years. 1,000 is maybe exaggeration, but what I mean is 50 plus years, okay? We're talking about GLP-1 agonists, we're talking about newer drugs that just came out, right? And they're going off the shelf and everybody wants to use it without even knowing the safety for 2 years, 3 years, 5 years, 10 years down the road, right? So if I were to take metformin, I'm a lot more confident taking metformin than the newer agents. Number one. Number two, it's not for everyone. There are people I see in my practice, there are people that I see outside, and I must have shared with you before, my husband is a gastroenterologist, and I often tell him, don't do any colonoscopies on people who are on metformin, stop the metformin first. So that's my piece of advice for him because, our system is broken. We overdiagnose, we overtest, we overtreat, we do everything too much, right? So in my practice of 25 plus years, I have come across easily 5 or 7 people who should not have been on metformin, and they paid the price for years of diarrhea, indigestion, gut health problems, and whatnot. So just trying to put it together, metformin is great in the right person. Not everybody should be taking it. If there's a reason for you to be on metformin, I won't shy away from that. I would take it. Metformin comes in different forms. It comes in simple metformin, and there's extended release metformin, which works better on the gut. But I've heard variations in that, and don't quote me on that, but there was a article that came out one time from American Diabetes Association, and they said the extended release is for $1,000 or something, and the other one is for pennies. So anyways, whenever somebody can't take it and I go try to do extended release, then I have to fight it, plea, do some begging to insurances to cover it, things like that. So, and then lately I heard from a pharmacist that it's not that expensive. So I don't know. I don't know why prices are hidden in medicine. I have no idea. Why can't this be very transparent? You and me are all on the same page there. It should be very transparent. It's not that hard. But the point is, if you need metformin and if you cannot tolerate, I would first take it with food, not empty stomach. It upsets your stomach. So if you take it with breakfast and dinner, it's usually given twice a day. If you can take it with breakfast and dinner, and if you do well, great. You don't need to change anything. If you're still having upset stomach, bloating, diarrhea, things like that, then you might want to request your physician to give you extended release. And if the extended release is covered, and if you're taking it, and if you're going well with for you, great, no point, no problem. But if you're still having diarrhea, get off of it. If you're still having bloating, because you could be that few handful of people who just cannot tolerate. Are we good with that? Okay. Simple answer for you, cancer feeds on sugar. Anybody who has cancer, anybody who's had high risk for cancer should avoid sugar. That's my simple answer. But it's a little complex. I don't know what else to tell you, but we'll go over that. Um, my mother-in-law has had throat cancer, and I think I've shared that with you before. And she cannot eat much. She's only eating pureed, and she gets tired of her options of pureed, and she eats a lot of sugary pureed too. And she's 97 pounds, so and she does not have diabetes. So luckily, she does not have to worry about the other effects of processing that as well. But um, not that I encourage her to take it, but when it comes to a point where survival and you have to get some nutrition, sometimes we are okay with those things. But if I knowingly am telling someone who has cancer, they should avoid sugar. Are we good with that? Cool. I did have some handouts and I passed those. I don't know if you got it. That was part of the reason that also got in my way. I wanted to make sure that I print them and get them ready for you. So gut health, thank you for asking me to speak on that. I think it's the topic that we all should know. And thank you, Ruth, for putting me in that uncomfortable situation, I would say, because gut health is not my specialty. And again, I asked my husband, I said, hey, why don't you teach us about gut health? And I can be in the audience and you come and speak. But he's lucky to be playing golf and he likes his life the way it is. And he's not an educator. He's not really into what I enjoy doing. And, to me, this is important. So that gave me a chance to learn from him, to read more and educate myself more. And thank you. Because of you guys asking me to do that, I think I'm going to be a better physician. We're not born with it, right? We all have to constantly learn. So thank you so much. There's a question right here. Mhm, mhm, mm. Yes. Thank you for bringing that up. So for people in the back who have not heard, somebody mentioned here that they're struggling with some chronic health concern where there's a knowledge of serotonin and dopamine and some neurotransmitters that are being affected by our gut health, and that's very true. That's very true. So thank you for coming and thank you for bringing that question. I did share some slides with you guys. If it can be put up, that's great. If not, I'm ready to go without the slides. But there were 5 slides I emailed you, Ruth. If somebody can open that and if they can, yeah, if this morning. So they can, if they can put it on, great. If not, don't worry about it. I'm good. Okay, let's talk about gut health. What comes to your mind? What do you think? What do you think is gut health? Let's take a bigger picture. What is our gut supposed to do? Digest, right? Right? It starts from the mouth and it goes to the anus, right? We know that, and it's a huge organ that is all tied up in our body. And why are we suddenly so much talking about gut health? We were not talking about it years ago. We were not talking as much. Is that right? Do you guys feel that way too? I mean, certainly there is something to talk about is social media and whatnot. There's more hearing, there's more listening, there's more people, and again, just being on that topic, try not to listen to everyone that you come across on social media. Please go to somebody who's reliable and who's authentic, because everybody's trying to be an influencer these days, whether they have the knowledge or not. So take it with a grain of salt. You had an answer? Yeah. Yeah, we just talked about that, and thank you for saying that. Certainly, those are good points that are coming out, but I'm trying to take your to a bigger picture here. Why are we suddenly talking more about gut health? Anybody else? Yes, because we're learning it's functioning, it's affecting our mood, it's affecting our behaviors, concentration, our focus, things like that. You said something? Yeah, great point. We're learning there's so much out there that has come up that was not there 20, 30 years ago, right? Our health is going down in general. You talk to anyone, either it's personal or their family member or their extended family or in the church or whatever, overall health is going up or down? It's down. Huge. Two thumbs down. Yes, I agree with you. And we need to wake up and see what's changed, right? And we'll talk about some of those things, what has changed. Um, and that is an amazing point that you made. We need to look at the bigger picture. Chronic health conditions are coming up. Chronic health conditions are things that have evolved over the years of, I don't want to say misuse, but effect on our body, right? Whatever picture we are creating, whatever we are giving to our body, whether it's mental, whether it's physical, whether it's environmental exposure or whatever it is. Can somebody name some of the chronic health conditions we are dealing with? Obesity. E. coli. That's an infection that's more of an acute problem that I can say, not the chronic health issues. Yeah. Right, right. So I would say definitely that's a very important point, but it's more to cause acute problem. You're not going to carry E. coli for years, or you're not going to have that, right? So what we're talking about right now is what are the chronic health changes that are happening? Diabetes, obesity, diabetes, chronic fatigue, depression. Yeah. Yes, absolutely, for various reasons. Cancers, yes, that's a chronic condition. Indigestion, gut problems, yeah, just poor health, poor gut health, right? So constipation, yeah, the constipation is a symptom of poor gut health, but not really, so it's related. And heart disease, for sure, yeah, metabolic health, huge elephant in the room that we're not talking about. And that is related to diabetes and obesity that we just talked about, right? Anybody else? Yeah. So you got a bigger picture, right? So why are we talking about gut health? Because there are more health issues going on, and we're trying to figure out what's going on here, right? So what I truly believe in is that we got to have a science-backed learning, right? We're not going to do just voodoo, whatever is coming up from ages of do this, do this. But there was some scientific background in that too. Like I've mentioned before, I'm from India, and the Ayurveda and whatnot, and how we cook and everything has some scientific background, which was never proven, but we're learning that now. Simple things like curcumin, This morning I was thinking about onions, we saute onions in every curry and things like that we cook, and I'm like, no wonder that onion and garlic sauteing is helping us that's a prebiotic that feeds the gut. So that's making the gut microbiome thrive. So, I mean, not that our grandparents read from Harvard or Stanford, they had no idea, right? But there was some knowledge that they had, whatever bare minimum things they had, that was helping our body, not hurting, right? The big picture, again, is processed food, right? Over the years, how much processed food you and me have seen, right? Now, for the elderly in the room that are older to me, I'm 53, but how many people are older than 53 here? Okay. So the point is, tell me about the Safeway and these grocery stores. Don't you feel disgusted when you enter there? I mean, talk about not just everything is packaged. Everything is packaged, and I just worry about the younger generations. When I tell my kids not to have packaged foods, they're like, "Mom, have you ever gone to grocery?" I'm like, "Yeah, I go there, but it's disgusting." I mean, we need to go back to our farmers markets. We need to go to get as simple living as possible, right? But unfortunately, our future generations are going to have a lot of difficult time. You can still understand because you can relate to it, right? Because your parents and grandparents and whatnot were there. But I think that's the simple message here. To improve your gut health, we'll talk about why improve, but to improve your gut health, if I say, what are the non-negotiable things? There's some people sometimes have to leave early, and I was late. So I sometimes go backwards, and I throw in my message out so that if in case you leave, you take that message with you, right? So if I were to say, what are the 5 non-negotiable things that you need to do to improve your gut health? Can somebody tell me? Yeah, that's certainly one, right? We talked about less processed food, or avoid processed food, right, as much as possible. Now, while we're on that topic, let's add a little more. What else do you think we should do less of? We'll talk about what should we do more of in a few minutes, but what should we do less of? Absolutely. Less of artificial sweeteners. So you're fooling your body. Don't do that. Artificial sweeteners don't help you. In fact, they confuse your gut, and they also take away a lot of your important chemicals that are made to help you get more serotonin to feel happy. So that is one thing. Two, your artificial sweeteners are fooling your pancreas and making it think that you're eating sugar, so it produces more insulin. And when it produces more insulin, guess what happens? Initially, the blood sugar will drop. Later on, you'll get insulin resistance because your body's not able to keep up. But more important, you're hungry all the time because you have more insulin, because your blood sugar is dropping. That creates that hunger, okay? So the artificial sweeteners are not helping us in any way, shape, or form, okay? They do get in the way of our body physically and mentally, how it's working. So we're going to do less of processed food. We're going to do less of artificial sweeteners. What else? What else do you want to do less of? Fast food, for sure. That again, yeah, there's a difference between processed and fast food. So let's to clarify. Fast food will have a lot of additives and other things that are in there, right? Processed food is packaged. This is not packaged. You might think, oh, well, I'm going to fresh cooked at, whatever, McDonald's or Taco Bell or something. No, they still have packaged, unpackaged for you to be eating, right? So we don't want to do that. Somebody was going to say something. Stress. Yes, less of stress. So right now we're talking about what can we decrease in our exposures, right? Less artificial sweeteners, less processed food, less eating out or fast food, less stress. So we got to do whatever it takes. You'll be surprised. Stress changes your gut microbiome. And I know I'm going the reverse way. We'll talk about the gut microbiome, but it does affect your gut health. It takes it away. What else? Sterile place, yeah. Yeah, no, great point, great point. And again, it's something very hard to say that we should not be cleaning, but overexposure to, Purell and those sanitizers and whatnot can be part of the reason. And again, I go back to India. The reason being, I grew up there. I was 25 when I came here. I never had any gut issues. Now I get some constipation and whatnot, and things have changed. But now when I go from here to India, I get sick all the time. I get sick so easily because it's so clean. And there I was getting exposure to those small microbiomes that were just coming, and my gut was healing it, right? So it was doing what? It was improving my immunity. My immunity has gone down over the years, staying in clean environment, right? So yes, that is absolutely true. But how do we change that in our daily living is not something I have a good answer for, because I'm not going to tell you to expose yourself to, pathogens. Less cleaning, yeah, as much as we can. Again, I go back to my mother-in-law who always complains. She says, well, I've washed my hands 20 times every day and I made the grandkids and I still got the cancer. But anyways, that's just besides the point. But yes, immunity can change. So we talked about earlier how gut health is related to mood, right? And then how gut health is now related to immunity. But there's one more thing I'm looking for. Antibiotics, great. Less of antibiotics will definitely help your gut health, because antibiotics does suppress your good bacteria or good bugs that are in your body. What else? Soaps, yes. They can overall help with sort of keeping those small bugs and getting the immunity up, right? So great point. There's one more thing I'm looking for. Sugar, sure. No, caffeine is a little controversial. We'll talk about it. It's supposed to be good too, in a lot of ways. Alcohol. Who said that? Thank you. Thank you. So less of alcohol or no alcohol or whatever you can do, right? So those are a few things. Did you all get it? What do you want less of? Less processed food, less packaged food, less alcohol, less stress, less sugar, less cleaning, less artificial sweeteners, right? We got it all? Now let's talk about what can we improve. What do you want to include that will help your gut health? Anybody? Sorry? Berries. Okay, certain food. Yeah, we'll talk a ton about the food. Okay, tell me more. What else do you want to include? Exercise definitely helps your gut health. Yes. Water, hydration, huge, huge. Okay. These are, guys, we're talking about non-negotiable. Hydration is huge. What else do you want to increase? Sleep. Yes, thank you. You would think sleep, really? What's up with the gut bacteria? Does the gut bacteria know when we're sleeping or not? Apparently, yes. Apparently, yes. Yeah. So, yes, those are great points. Anybody else? Anything else? Fiber. 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 Get as much fiber as possible. I think you guys are lucky to be all living on acreage or, in this, outside. So probably have a lot of fruits and vegetables. At least we get exposure. We're better than Sacramento or downtown, right? Or the bigger cities. Yeah, do your fiber as much as you can. There are two kinds of fiber while we're on that topic, soluble and insoluble fiber. Anybody has examples of soluble or insoluble? Yeah. Sorry? Oatmeal. Yeah. Yeah. So fruit and fruit peels, that can be different. Citrus, yes, of course. So just make sure whatever fiber you're including, psyllium husk is another soluble that you can add to your food. Metamucil, that's what it is, psyllium husk, I believe. That's where it comes. But yeah, improve the soluble fiber if you can. But some people need more insoluble fiber too because of their gut health, okay? So don't generalize this. Just including more fiber is definitely helpful. Okay, so now we all got that. What are the most important non-negotiable things that we cannot compromise? That goes to everyone. Doesn't matter what your health is. Whether we're talking about Parkinson's, whether we're talking about diabetes, whether we're talking about hypertension, whether just talking about healthy aging, no matter what, everybody benefits from that by cutting down things that we talked about and by increasing the things we talked about. Now it comes to very much, who's got what health issues. So if you have ulcerative colitis or Crohn's or things like that, then certainly you need to see a gastroenterologist to help with other system as well and get more specifics of what you should be doing for your gut health. So don't take this for like absolute prescription, but it's more of a generalized advice. Now let's talk about gut microbiome. What is this gut health, right? One is digestion we talked about. You eat and you process the food, you get the nutrients in, and then you excrete the roughage, right? Whatever doesn't belong in our body is thrown out. Where does this gut microbiome come from? What is gut microbiome? Anybody? It is influenced by genetics, yes. Yeah, these are different kind of bugs in our system. Could be bacteria, yeast, fungi, all different kind of bugs. So think about our gut as a garden, okay? It's a garden where you want all the good flowers and you don't want the weeds, right? So all the good bugs, we want them to thrive, and the bad bugs, we want them to eliminate. So all you eat, how you sleep, how much stress you have in life, all those things change those bugs, okay? And there are billions of those. So I'm not going to spend much time about the types of bugs you have, how to improve certain kind of bugs. What you need to understand is there are different kinds of bugs in our system. Everybody has it, okay? They have done studies in animals where they've taken mice and they've sterilized them completely, and they've taken the gut microbiome out of their system, okay? Which is not very nice, but sure, the studies that had to be done. And guess what? These mice had to eat 30 to 50% more to survive. So it's so much gut microbiome does for you. So whatever you eat, it processes it in such a way that it changes the signals to your brain, how you eat, how you feel hungry, how you process your immunity, things like that. So we know the studies have been done. We know the studies are ongoing, even at, not just small levels, but Harvard, Stanford, Mayo Clinic, you name it. Yeah, I remember many years ago, my husband says, "Do you have a blender that I can use?" And I'm like, "What do you mean?" He says, "It's not coming back home." I said, "Okay, what do you mean it's not coming back home?" That's when he was the first one at Sutter Roseville to do the fecal transplant. Yeah. So, and I had first heard about that, and I'm like, ew, why would you do that? But now it's a norm. We know more, right? What they're saying is if somebody has a healthy gut microbiome, and if you transplant that into somebody who has poor gut microbiome, it can change their picture completely. So that's the extent of science I'm talking about, okay? Just sharing for people who don't know about that. So that's the kind of thing that's happening in some centers as well, where people who have chronic gut issues that just cannot be treated, they're getting fecal transplant. I'm not telling you who gets it, why they get it, and all that, because that's beyond my scope of practice, okay? Now, so you all got that? We have a gut microbiome that needs to be healthy. Everybody has it. Nobody's born without it. Genetics plays a role. If you feed it a lot more sugar, you're going to get the bad ones out, the ugly heads that you don't want them. And you put the good ones silent. And when you put the good ones in silence, guess what happens? Bad ones overgrow, and you're dropping your immunity. And when you have low immunity, what happens? When your immune cells are not there to fight something bad, then what happens? You get sick quicker. Doctor's appointments happen. Okay, when you have that situation, that's when autoimmunity happens. That's when cancer happens. That's when depression happens. That's when everything else happens, okay? So we have learned so much that you need to give a lot of TLC to your good bacteria. Whether it's bacteria or fungi or whatever it is, but the microbiome is a general word that we use, okay? So you really need to take care of your gut health by feeding it the right thing and not feeding it the wrong things. Does that make sense? Yes, cancer has been associated with this. More colon cancer. There are tribes in Africa and other places which are living in the jungle, and they've tested their gut microbiome is many times more than us. And Westerners have gotten rid of their good microbiome by eating the more advanced diet. That's why we say go back to basics, right? Now, I'm not here to tell you not to eat meat, but the studies have clearly shown people who eat more plant-based diet have better gut microbiome. So in other words, if you are a meat eater, think about what kind of meat you're getting, where you're getting it from, how can you minimize it? Okay, I'm not telling you go plant-based only, because I've heard of a lot of patients who will say, I'm not listening to that doctor who says only eat plants. I'm not trying to change your life completely, but all I'm trying to do is share that information with you and let you know that people who eat plant-based have better gut health. Now, what do we mean by plant-based? And how much do we eat? First of all, let's talk about things that we are not going to talk about much. Red meat, if you're eating it, if you can give up, great. If you cannot give up, minimize it. Minimize it to 1 or 2 days with the smallest portions. Is that simple? Now, if you're done with red meat, then comes what other can you eat? What else can you eat? Fish. Salmon, sardines are considered to be the best choices with omega-3 that really help our brain and our gut. It gives you almost 25% of the fat that you need in your brain. It helps a lot. So if you want to eat meat, go to the right thing, okay? If you can have that, that's great. Now let's put the meat aside. I'm just going to talk about that much about the meat. Plants. The more variety of plants you eat, the better it is. Variety. apparently we should have at least 30 kind of plants a week. Okay? Now you might say, well, that's hard. Come on. How can we do that? And I said the same thing. It's not that hard. Not all plants are vegetables, okay? Spices, herbs, they're considered to be plants. Okay? So when you cook, you put those spices and it gives you the beautiful aroma and it gives you the taste and whatnot. It's all benefiting you. Okay? You can put your spices in a jar where you have a mix of your Mediterranean spices together. So you're already putting 4 or 5 together, right? You can have your grains and your, those could be together in a jar where you can cook them together in a soup or whatever you want to do. So you got 4 or 5 of them together, right? Then you can have your nuts and seeds. They're also plants. So if you have a handful of nuts and seeds a day, whatever amount you're eating, you're getting all different varieties. So instead of going with consistency, go with variety and swap it, change it. Okay, so if you don't like to mix it all, then if you're doing almonds, then make sure you get walnuts next week or do something to change it. Because there's certain gut bacteria that like certain things, just like us, right? Don't we like certain kind of food and, we like the variety? Same thing, the gut microbiome. They like certain kind of food. So if you feed the same thing every day, there's some that'll keep sleeping, that don't care for the food you're feeding them. You may be thinking it's the best, but they may not consider that the best, right? So it's good to introduce different kinds and change it over time. Water, of course, you got to hydrate. So we got it. What feeds it? What works? We'll talk about prebiotic and probiotic and those things in a few. But you got the food. Essentially, what we're going to do, we're not going to drink sodas. We're not going to do diet sodas. We're not going to drink alcohol. Minimize it as much as possible. And you're going to put as much water as possible, as much plants as possible. And how do you decide what plants and what not? We talked about few, but we can go over some questions and include that. Oats certainly give you a lot of fiber. We talked about that, so include a lot more fiber-rich food. There was a question here. Mm-hmm. Yeah. That's a great question. Great question. Yeah, so the point is you do need to take antibiotic every now and then. I'm glad you said it that way so that we don't do knee-jerk reaction to antibiotic. A lot of times patients will say, I need antibiotic. No, you don't. You don't always need it. Because all you're doing by taking antibiotic is you're treating yourself mentally. It's not helping whatever infection you had because you're not giving your body a chance to heal. You're not letting your immune cells to work because you're telling your immune cells, keep sleeping. I'm going to put a drug from outside to kill it. You want to make your body equipped to do a lot more things, right? So the question is, if you take antibiotic, what can you do to improve your microbiome? You can take probiotic those days if you're not taking earlier. Take more fermented foods, around that time. Kombucha, one of them. Kefir, I don't know, everybody says it a different way. Who makes yogurt here at home? Anybody makes your own yogurt? Yeah, I do my own yogurt. And that's because probably the way I was raised. The processed yogurt that you get has a lot of sugar. But the question comes in, how do you buy milk? Or how do you buy something that does not have sugar? Because milk has sugar too, the pasteurized milk that we're getting. Yeah, that's a story for... There is some degree of sugar that is in the processing. Yeah. A2 milk is considered to be better. That has a lot more. A2. Yeah. Costco has it these days. A2, I think it's the non-pasteurized, but it's... Sorry, you were saying something? I don't know exactly what it stands for. Anybody knows that more? Yeah. I would love to... I'm sorry, I would love to follow up on that later. Maybe I can send an email. But that's... Yeah, and A2 milk is supposed to be better for your gut health. and for I make my yogurt with that as well. Um, I think they are both fine. You can have both. Nutrients might differ, but there's no reason to not do one versus the other. Question? I do both. Yeah, now I do A2. Previously, I was doing the regular milk that I get. But I do like to make my own yogurt. It's pretty simple. It's not that hard. I thought it's a big deal forever, and my mom taught me, and I now make it. All you do is you boil your milk, you make it warm. Once it's warm, then you put a little bit of your previous yogurt that you have, mix it in there, and cover it up, leave it overnight, and by morning you have a beautiful yogurt. 5 to 6 hours, that's all you need. So you need to put your yogurt previous, that's the starter that you have, that you need to constantly put it in the boiled milk. I don't know. Great question. Try. Anytime you make yogurt, you're going to have fermented food. It's not going to hurt you. It's going to help you, if anything. So what else? Fermented foods. What else do you do? Anybody? Sauerkraut. Yeah. Mm-hmm. Mm-hmm. Okay. Sorry. So it's not unpasteurized. It has a different um, uh, casein. Yeah. Good. Thank you for telling me. I'm sorry. I did not know that enough. I would have. Yeah. Yeah. While on that topic, everybody's imprint of our gut microbiome is very different. Even a mom and daughter is very different. Even, and then we also have a theory that vaginal delivery, kids have better gut microbiome. And there's a reason that's why we prefer those over C-sections and whatnot. Kids have more gut issues if they are C-section versus vaginal delivery. Yeah, everybody has their own DNA imprint. And now we'll talk about who should get tested, why should we get tested, how do you take prebiotic, probiotic. Questions? Somebody was making us. Absolutely. Kimchi, sauerkraut, yep, yep. Any kind of fermented foods, if you can include, that'll be great. Can I use this, please? Thank you. Okay, so we talked about the gut health, why gut health matters. So let's talk about what are the different conditions. Why are you talking about? 70% of the immunity houses in our gut. Okay, so if you don't take care of your gut health, that's when autoimmune conditions happen. That's when you have more allergies, you have more intolerances to food, you have more, malignancies and things like that. So how they, because your body is not able to protect the good cells, that's when you have uncontrolled replication. Go ahead. Yes, absolutely. Great point. Yeah. Glucose intolerance. He's saying he has some of the friends who have glucose intolerance. So I was just going to come down to that topic. What do you think are the things that are happening by not having good gut health? We just talked about immunity. We previously talked about serotonin. 90% of serotonin in your body is produced in the gut, and that's keeps you happy. Okay, that's another thing. Metabolic health. That is huge, and that's why you get the metabolic syndrome, impaired glucose tolerance, or that's a spectrum of conditions, right? So once first you get is uh, impaired glucose tolerance, okay? Then you get metabolic syndrome, then you get pre-diabetes, then you get diabetes. So it's a same thing that is progressing. So basically, to keep your metabolic health in check, having gut microbiome healthy definitely helps a lot. And that again depends on what you eat and how we choose food. So it's these things are not in silos, these things are all interrelated. So that's why we go into holistic care. We go into the basics of medicine, right? That's why we go into what's the foundation? How can we improve my foundation before I go into specifics of impaired glucose tolerance or Parkinson's or my immunity problems and whatnot? Anybody has a question here? Sure. And thank you for sharing that. I think that's a powerful, simple story that has a huge implication, right? So for people who did not hear in the back, he said he used to be on PPIs or proton pump inhibitors. That's a class of drugs that we give for heartburn. And since he changed his diet and got some supplements, he's been off of those drugs. And that's not rocket science in my mind, but it's basic, and that's why I say our system is broken. Because if you don't work with someone who believes in these things and who works on it, again, nothing against naturopaths. Some naturopaths have done wonders, but sometimes you miss big things when you don't expand your, when you covering your basics. But our medical system just does not work well, and I've worked in this for 25 years, and now I'm going into functional medicine because I have so much appreciation for these things, and I'm sick and tired of writing prescriptions. Prescriptions are not the way to go. And there's so many times I talk to my patients and I say, hey, we should change this in diet and this is it. And there is a question mark on their face that I came to you for writing me something, and come on, am I going to pay you this much just to this? It's not that. It's that we need to get down to the bottom of how do we improve your health. We don't want prescriptions, guys. If I have a problem, I don't want prescriptions unless I absolutely have to have it, right? And then you talk to the right person and say, what are non-negotiable here, right? Like, for example, metformin. I would say, let's go back to that same story. If somebody continues to eat highly processed food, high sugar content, eating out and whatnot, and drinking the alcohol and drinking the sugar and everything else, then taking metformin is not doing much, right? So it all depends. What are we putting in the foundation and how we're building up? Now, let's say I have a friend or a patient who has impaired glucose tolerance, and that person has done everything, changed their diet in every way, and they're eating really well, sleeping on time, managing their stress, drinking, staying hydrated and everything, and the impaired glucose tolerance continues, then I clearly know that person is on the way for a heart attack. Then I'm going to add a metformin. Then I'm going to add Ozempic if I need to. Then I'm going to add whatever it takes. Does that make sense? So there's times when you don't negotiate. But when we practice regular medicine, when you go to all your doctors, how much time do they spend with you? 10 minutes? Some 5, some people like me spend 30 minutes and they end up getting yelled because now the other person waited a long time. So I get it. All that system comes with some challenges. But the point is, everybody gets a PPI. Everybody comes with a heartburn, will get something to stop the heartburn, not to go down to take the 30 minutes or an hour talking, what are the foods you're eating? How are you, managing things? Sleep on your left side. How many of you know sleeping on left side has tremendous benefits? Tremendous benefits. Sleeping on your left side. Yeah. Things like that. Simple things that can really help you not get on prescriptions. So I'm trying to create my practice in a way where I want to give up to other people what I want to be treated as. And I totally believe in the foundation. And I totally believe not only are you getting that prescription for no reason, the PPI, because we're just treating what? Symptom, right? We're not working on the foundation. But guess what? PPIs do. It stops you from absorbing vitamin B12. It stops you from absorbing magnesium. And guess what? You're going to be super tired. And guess what? When you have low magnesium, what are you going to have? Arrhythmias. And you're going to be in the ER and you're going to get shock. Okay? So these drugs come with a bunch of side effects that get overlooked when we're just doing knee-jerk reactions. And yes, it's good to be involved in your care. I think one thing I'll suggest to you is go to your doctors whenever you go. Just say, doc, these are absolute medication. Do your homework, okay? This is nothing more frustrating for me when I see a patient who does not have their medications in their hand. When I'm throwing things in the dark and I'm just trying to call pharmacy, now it's taking me longer or whatever, right? So even if you say, you should have my drugs, you should have my medication, no, just take personal responsibility, okay? Systems make errors. Systems cause problems. I have thousands of patients, right? My worker may not be in the best mood that day. My worker may not have put in 100% effort in making sure. There could be an error, right? But all we can do is be our own health advocates, right? Very simple. Take care of your health. Write down everything before you go. Write down your questions. Write down your medications and your doses before you go to your doctor's visit. Whether you're going for a healthy visit or unhealthy visit, doesn't matter. Make that a routine. Get all your testings done around your birthdays. So you know that my birthday is a time to check my health, right? Get your mammograms, get your colonoscopies, whatever it has to be done. Either you can work them around so you never have to think. You know, when your doctor says, oh, was the last time you had a bone density? Oh, I know it. I get it around my birthday, and I get it every 2 years, you know, because of insurance coverage and whatnot. But mammogram, the same thing. Or the other thing is you can do everything in January, if you can. So that way you don't forget, okay? So as a physician, what frustrates me is when I ask a patient, some doctor started them a PPI or something and they didn't share with me, okay? And I don't know. And the person forgot, or I didn't know that, or maybe I have it they're taking and they stopped it. So just confirm what you are taking is updated in the system and you take it in your hand every time, okay? The newer kids are a different story. They want everything to be automated and whatnot. Yes, we are trying to get automated in every way, but if you take our personal responsibility and take our paper with medications, then you have right questions you can ask. You can think about it. You can plan for your health, right? You can say, doc, help me understand what are the side effects we're looking at. Do we need to add some supplements? Are we there together, everybody? Now, question. Mhm. Can I get some water? Can I get some water? Thank you. Mhm. Do you still have heartburn? Could be many things. I would think if you're not able to get right answers, it's time for another doctor. Good, good, good. Thank you so much. I'm sorry, I hated to ask you that, but yeah. No, I think that's fair. I always tell my patients, you're not going to offend me. If my intention is right, I'm always trying to help you. But again, mistakes happen. I may do a good job in helping 90% patients that day, and maybe I was not able to get 10% the best of my intentions. And if things are not working out, it's always okay to have another doctor or another opinion. Talk to me, let me know, right? So you do the same thing and you say, hey, I'm trying to find some answers here, and nobody should be offended with that. And you're doing the absolutely right thing. You're doing. It's taking away the acidity. Yeah. So it's got a lot of impact in overall gut health. So every medication comes in with side effects, but anytime you're working directly on gut health, the medication is going to change your gut microbiome. I cannot tell you more than that because, again, this is not right. But what we're talking about is when you take antacids of any kind, you're changing the pH of your gut, of your stomach, and then you have more alkaline stomach, not as acidic. So what are you going to do when you don't have as much acid? You're going to inhibit the good bacteria, you're going to flourish the bad bacteria and whatnot, okay? So that's why any medication that you're taking, you need to know why you're taking, and you absolutely need to continue it. So good for you. I'm glad you're going to another doctor. Yeah. Any other questions? I think we got a little bit off track, but these are all important questions that help us every day, right? Question. Turmeric and curcumin, yes. Curcumin is part of turmeric. It's the chemical in there. Even though science has shown so much, again, this is an example of balance, what we're talking about, right? I was born eating turmeric from day one because that's part of Indian food, right? My mom has arthritis. She was born eating that. So not everybody's protected against things when you're eating certain things. And what we have learned is when you take those supplements, like Last night, somebody was asking me, what do you suggest me? And I said, take turmeric pills. Because when you take it in a concentrated form, they do much more benefit than when you're just putting in the curry and whatnot. Okay? It's the same thing as cinnamon. When we say cinnamon for impaired glucose tolerance or for prediabetes or for diabetes, it helps. Okay? Chromium and cinnamon are both supplements that help diabetes or processing sugar. But again, if you just sprinkle the cinnamon on your coffee, or doesn't do much. You need to take it in a concentrated form to benefit. So that's why these supplements are altogether a different beast. So it's good to have healthy diet. I'm not saying replace your diet with pills. No, we got to have healthy choices. You know, simple garlic, onion in your diet will feed your good bacteria, and that's working as a prebiotic. Prebiotic is the food that you give to your gut microbiome to make it healthy. When you take probiotics, those are the healthy gut microbiomes that you're eating, like in fermented food and whatnot. I can talk briefly about it, not a lot, but here what you're referencing to is SIBO. Have you heard of SIBO? Bacterial overgrowth. It's a new term that was coined recently, okay, in the last decade. It's not something I learned in my medical school 20 years ago. SIBO, SIBO, small intestinal bacterial overgrowth. The bottom line is most of these bacteria and microbiome should be in the big, um, uh, large intestine, not in the small. So whenever you have a small intestine that's getting more of bad bacteria that shouldn't be there, that's SIBO. And what it does is it causes a lot of GI symptoms. You have chronic diarrhea, you don't digest, you have a lot of weight loss, malabsorption, things like that. So SIBO is overgrowth of bad bacteria in a bad place. Does that make sense? Yeah, that's why you hear a lot of that lately, because these are things we're learning over time, how our eating is changing our gut microbiome. Mhm. I'm glad you picked that. Yeah. Okay, so the question is, would you do stool testing? Who should get stool testing? How does it help us? Right? Indirectly? Yeah. Yeah. So I take that with a grain of salt. We don't have the best reports. Biome, GI mapping, there are few other tests that are available these days. These cost anywhere from $100 to $500, depending on which test you do. And we don't have the best results, and they cannot be replicated. When you cannot replicate, I don't know how much I can rely on that. So I might consider doing that in certain people for certain reasons. And what you need to understand is if the same person does the same test a few days later, the impression will be completely different. So that's why I don't know whether it's worth spending that much money. I might consider doing it in certain tests, certain people, but I would not blanket it for everyone. No, they do DNA sequencing nowadays. Yeah, they do a lot of detailing stuff. So things are getting refined and better and better, better every day. But what you don't have control over is what you're eating. Your eating is going to change every day. You cannot have the same, absolute same thing every day. And how your gut microbiome react to that is different. So what you see in the stool is going to change every day, right? And also environment and everything else that you're exposed to, the air that you're exposed to, all that changes your gut microbiome too. Yeah. I am not in a position to answer that. That's a very complex question, great question. But again, I'll go back to the basics. If you make intentional choices and intentional, eating and intentional lifestyle choices every day, then majority of people should not need gut transplant or stool transplant. I would think so. I would believe in that because there's so much we can do every day. Yeah, but some people need the stool transplant. Like I believe SIBO patients need that. You know, people who have overgrowth of one certain bacteria to reset it, they need it and things like that. Again, I'm not a gastroenterologist. Please don't take that word by word. That's a great question. Yeah. Let's try. Let's try. Let's try to answer. Okay. Another question? Yeah. Great. Yep. 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 Okay. Yeah. So I'll give you my example. Yesterday, I was trying to research on Aura Ring. How many of you have heard of Aura Ring? Let's see. Aura Ring, OURA, RING. These are newer tools that we have to measure our health metrics. Okay. So it tells you how's your heart rate doing, how's your blood pressure doing, how's your sleep, how's your stress, things like that. So it's just a simple ring that you wear. You probably see a lot of people wear that ring. It has, this is not an Aura ring, this is just my band, but it has electrodes inside. And when you wear it, you must have seen some people wear like it's silver or gold or platinum or whatever, or some have black, you know, so they're wearing band like a structure that is measuring a lot of their body measurements. So I thought it's pretty cool. I'm going to use it and I'm going to buy it. And I looked at the cost and stuff, and it was pretty expensive, $400 to $500. And I thought to myself, do I really want it? And then I started doing research difference between Apple Watch and Aura Ring. And there's not much that you get from Aura Ring versus Apple Watch. So I had to have a self-talk to myself. And I said, girl, better wear your Apple Watch every day first. And then better wear it when I sleep because I don't like to keep anything on me. How can I measure my sleep if I don't even wear my Apple Watch, which has a lot more reliability, right, compared to the Aura Ring at this time? Simple things like that. So some reports reported some young people say it gets in the way of picking them weights and whatnot. But, you know, so you can say some people don't like to wear something watch at night, so ring is better. So everything has their pros and cons, right? But my research suggested me that what I need to do is wear my Apple Watch and I need to sleep. If I don't sleep, what good is that measurement for? If I'm giving myself the blue light at night and not sleeping on time, what good is that ring for, right? So I could easily say I don't need to spend that money. Same thing goes to the stool transplant. If you know you could eat better, if you know every day you could exercise better, what is the ideal day like? You want to get up in the morning and see the sunlight, like she said. You want to have that exposure. You want to have the best you can eat, have fermented food in your breakfast, lunch, and dinner. Have small portions. Have as 10,000 steps a day, you know, if you can. If you can't do 10,000, do 5,000. Do as much as you can. Drink as much water as you can. Minimize your exposure to other things. That's what the ideal day looks like. Meet friends, community, huge, huge benefit of being in the community. It's great to have a community where you can sit together and talk. Isolation is a disease. Try to avoid isolation. That's why people with addiction, they try to be isolating themselves, and you don't want that. If you have a family member who's trying not to talk, pick up that damn phone and call them. Try to take the higher road and tell them how much you care, you know. Simple things, whatever we can best do. I think that's what daily life is. Minimize the stress if you can. You know, go at times, you know, don't go in the rush hour on the road if you can avoid. Do natural food shopping as much as you can. Don't go to the grocery shops if you can avoid. As much resources as you can, get natural. Stay out in the sunshine and what our grandparents did, I guess. That's the best way to do it. Yeah, question. I personally don't believe in that. I don't want to take something extra I totally believe in very simple, basic things that we went back to. You know, we talked about non-negotiable 5 things, and that includes what you shouldn't have and what you should have. So if I'm able to eat more fiber, if I'm able to have better hydration, if I can have fermented food every day, those things will do a lot more benefit if I'm having my omega-3s in the form of salmon or fish oil, then I don't need to take olive oil at bedtime. Make sense? So it's not that as complex as what the social media is talking about. And yes, some doctors are talking about that too, and that confuses the hell out of all of us. And you're like, really? What are you talking about? Why should I take a spoon of olive oil? I mean, you can go back to, again, the question of, will it hurt you? No. Olive oil is not going to hurt you. Depends on the source where you're getting it from. If you take it at bedtime, will that help your gut health? It will definitely help your gut health because it's one of the Mediterranean diet processes that helps your gut health. So again, there's no problem doing that, but do you really need to make it complicated? Right? Vinegar, I don't know what to tell you about that. Yeah, apple cider vinegar, a lot of research has been done. There's some benefits to that. I again go back to, if you eat your own healthy food and you create your own pH balance in your body, you'll get enough of acidity that is in balance for you, how much you need, than to take extra from outside. Yes, there's some question of apple cider vinegar helping you cut your appetite. But how about if you do other things that help us with appetite? Don't do calorie counting. Calorie counting does not help anyone. Eat healthy, eat small portions, eat what is natural. You know, if you do those things, that'll help you a lot. There's also some understanding that calorie count does not need to be as precise. So whatever you read could be vary by 20% or so. So if you think you're doing really good with your calorie counting, you may not be. So I think we just need to go back to the basics. That's what I'll say. Choose the right food. Look at the source where you get it from. Get meat from not the place where they have, where it should be as natural as possible. And how are they raising, where the food is coming from. Mhm. They're both equally good for your gut microbiome. Whole grain is good, sourdough is good. Both are good. It's because it's fermented. Yeah. I think those are simpler choices. You're talking about two good things to compete, right? If you ask me about white versus sourdough, I'll tell you pick sourdough, right? Other questions? Yes. Mm. Mhm. Yeah. So, yeah. So the question is, guys, about Ozempic. How many of you have heard of Ozempic? Everybody? Not everybody? Ozempic. Most of you have heard of Ozempic, right? Yeah, yeah. So Ozempic came out in the market um, almost a decade ago now. It's getting more popular now because it came out for weight loss now. Um, it's relatively very safe in the right person. It works by 5 ways. It changes your appetite, works on the appetite center. That's why people are not craving food. Most of my patients will say, it takes away my food noise. Yeah, takes away the food noise. You're not constantly thinking about and pre-obsessing yourself with food. It works on your gut by slowing the gastric emptying. So what it does is the food in the gut will stay there longer. It's not going to empty into the small bowel. What does that do? Fullness. Fullness can be good. Fullness can be bad. If it's too much fullness, it's going to come out. So I always tell people, if you're throwing up on Ozempic, you just need to look at what you're eating. It's not because it's hurting you. It's a very simple side effect that can be avoided or prevented by eating better. So basically, your gut is telling you to eat small portions, but if you keep feeding big portions, you're going to throw up. Some things can give you nausea, some things don't. Nausea can be treated. So in the right person, these are miraculous drugs. Then it also decreases your gluconeogenesis. It works on your liver by making less glucose. So people with impaired glucose tolerance and things like that, it really helps a lot. Again, we have to think about it. It's a great medication for the right person, provided that person has worked on their foundation. If they're not ready to work on their foundation, they just want the drug, you stop the drug, they're going to get back to where they were, right? So it's all mindset change that we have to do. Are there any hormonal effects? Yes. The company's selling it in a way, Novo Nordisk makes Ozempic, Rybelsus, and Wegovy, okay? The drug is called semaglutide. Semaglutide is made into 3 products by Novo. Same chemical, same drug, okay? It's the same chemical that is marketed under 3 names. Semaglutide called Wegovy, this is what frustrates me, because I have to hire 2 people to do prior authorizations so that my patients can get their drugs, just because the industry is making their own. Why can't you just sell semaglutide? And I have to beg them to give certain medications to people. However, so semaglutide, when it comes as a brand of Wegovy, we can write it for people who want to lose weight. I cannot give it to person who has weight loss issues, who has diabetes. I have to write Ozempic. Don't ask me why. They're the same chemicals. Rybelsus is the same thing. It's a pill. So these 3 are made by Novo. Lilly makes 2, Mounjaro and Zepbound. You've heard of those, right? And recently there was a study that came out, and the data was published in NEJM, which is the best journal that we have. And it showed that there was 30 to 40% more weight loss with Mounjaro or Zepbound versus Wegovy. And that's when the stocks crashed for Novo. But the point is that, yes, we knew that all along. It's just that they had to prove it, because in the real medical practice, we have to have had study that proves this is superior versus inferior, whatnot, right? But in my practice, I was seeing people with Zepbound and Mounjaro were losing a little more weight compared to Ozempic. So why are we talking? Because they have 2 peptides. It works on 2 different, So it has a GIP and a GLP-1, and semaglutide is only GLP-1. So there's a reason why that happens. But the point is, guys, these drugs work great in the right people. But if everybody wants to be on it, it's not going to be great in the long term. And what we don't know is how to change your gut microbiome. There'll be studies that'll come down 5-10 years from now. So you asked me about the hormone changes. Yes, it does change the hormones, and your appetite signaling hormones, ghrelin, and leptin, which is appetite suppressing hormone. But the point here is, guys, that the companies are marketing it as that, oh, well, we didn't know this before. Now we know obesity is not just eating in and eating out and whatnot and what you're putting in. It's a big deal. It's a hormone issue. So you really need to be on the drug. Does that make sense? So it's a marketing thing where you say, oh, well, now we know a little more about obesity. Yes, certainly we know a lot more about obesity, but are you working on a foundation? If you're working on a foundation, yes, we know some things could be benefiting by taking these medications, but not everybody needs it. Yeah. Does that make sense? Okay, cool. Questions? Are we good? I think we're short on time. Yes. Okay, why don't we wrap up? I think we've covered everything, and I have given you some handouts. One last thing I want to tell you was proactive approach. You got to take it in proactive for better quality of life, and you will stay healthier if you just feed your gut right. You're going to prevent cancers. You're going to prevent autoimmune conditions. You're going to prevent allergies. You're going to prevent diabetes. You're going to prevent heart disease, things like that. So just eat pure and fresh. Good luck. Yeah, of course. Smile will definitely help everyone.
Honey, thank you so much.
Of course. I hope you enjoyed.
Enjoyed it, honey.
Good.
And I'm
I'm so glad.
87 years old.
Oh, good.
I
I'm
enjoyed
glad.
it, honey.
Lovely. Thank